नमस्ते बिटिया, हमेशा खुश हो। A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Medical Science at JAYOTI VIDYAPEETH University. This is the series of respiratory disorders, and in this series, we are discussing about tuberculosis. In the last lecture, we have discussed about the definition of tuberculosis, the etiology, the pathogenesis that is taking place in the cases of tuberculosis, the various clinical features of tuberculosis, the various investigations that could be done in the case of tuberculosis. In today's lecture, we will be talking about the management of tuberculosis or the therapeutics of tuberculosis. Tuberculosis is a very common disease in India, and it has affected a lot of people since very long time. A lot of people are suffering from tuberculosis and they are taking therapy. Indian government has made the treatment of tuberculosis absolutely free of cost in government centers. That includes DOTS centers. So let's start with the therapeutics. What are the various modern medicines that are prescribed to the patients of tuberculosis, along with the management of homeopathic therapeutics? The first line of treatment when a patient is coming to you for treatment of tuberculosis, after the diagnosis, the confirmed diagnosis of tuberculosis, the first line of treatment consists of initial phase, that is of 2 months. The following medicines are given in the initial phase of 2 months: rifampicin, isoniazid, ethambutol, and pyrazinamide. This course consists of 2 months initial phase. Then there will be a continuation phase of 4 months. It consists of isoniazid, rifampicin. If the pyrazinamide is not given or cannot be tolerated by the patient, then we have another drug combination for the initial phase of 2 months. That consists of ethambutol, isoniazid, and rifampicin. And there is a continuation phase of 7 months that consists of isoniazid and rifampicin. The second line of anti-tuberculous drugs consists of streptomycin, kanamycin, amikacin, capreomycin, fluofloxacin, levofloxacin, moxifloxacin, ethionamide, and prothionamide. Cycloserine, PAS. Cycloserine and PAS are basically 2 bacteriostatic medicines. There are various homeopathic medicines that are indicated in the case of tuberculosis. Although the treatment of tuberculosis or any other disease in case of homeopathy depends upon the totality of symptoms. The detailed case taking of the patient is taken, including the mental changes, the physical changes, the particulars, and the common symptoms. All the symptoms are analyzed and evaluated properly, and after the analysis and evaluation, a symptomatic totality is prepared. The symptoms are then repertorized using a proper repertory of choice, and then a final medicine is selected with the help of a DMT. There are a lot of medicines that are indicated, but the actual treatment of tuberculosis can take place only by the use of constitutional medicine. And it is single selected. in a minimum dose. But there are various important medicines that have a very important role in the case of tuberculosis. The various medicines include sulfur, arsenic album, arsenic iodatum, tuberculinum, phosphorus, iodum, silicea, sanguinaria, calcarea carb, lycopodium, bryonia, calcarea phos, ammonium muriaticum, calcarea iode, sepia, nitric acid, and calandria. Now we will discuss each medicine one by one, along with its clinical features. In arsenic album, the cough is worse after midnight. It is worse by lying on back. The expectoration is scanty, frothy. There is darting pain through the upper one-third of the lung. There is wheezing respiration. The hemoptysis with pain between the shoulders and burning heat all over. In ars iode, the ars iode is prescribed in the early stages of tuberculosis. There is an afternoon rising temperature indicated by a profound prostration, rapid irritable pulse, recurring fever and sweats, emaciation and tendency to diarrhea. Another important medicine is Balsamum peruvianum. It is useful in debility, hectic fever, phthisis with mucopurulent, thick, creamy expectoration. There are loud rales in the chest, which is also present in calicel and anthem count. Very loose cough with hectic fever and night sweats, with irritating short cough and scanty expectoration. Calcarea iode. It is used in the treatment of scrofulous affections, especially enlarged glands, tonsils, etc. Chronic cough. There is pain in the chest, difficulty in breathing after syphilis. There is hectic fever, green purulent expectoration. Another very good medicine in the cases of tuberculosis is iodine. There is great debility. The slightest effort induces perspiration. There is great weakness about the chest, palpitation from least exertion, pleuritic effusions, and there is tickling all over the chest. Iodine cough is worse indoors and in warm, wet weather, and when lying on the back. Calicsulf. There are coarse rales, rattling of mucus in the chest. The cough is worse in the evening and in hot atmosphere. There is croupy hoarseness, cough with yellow expectoration. There is rise of temperature at night and intermittent fever. Philodendron aquaticum, a very good remedy with offensive expectoration and cough and phthisis. Tuberculosis affecting generally the middle lobes. Everything tastes sweet. The dyspnea and continuous cough early in the morning. Cough with profuse and fetid expectoration. It compels the patient to sit up. Phosphorus. The whole body trembles with cough. The sputa is rusty, blood color or purulent. There is tuberculosis in tall, rapidly growing young people. Sulfur. There is oppression and burning sensation in the chest. There is difficulty in respiration. The patient wants windows open. There is loose cough, worse on talking. In the morning, there is greenish purulent and sweetish expectoration. Much rattling of mucus. Tuberculinum of undoubted value in the treatment of incipient phthisis or tuberculosis, specially adapted to the light complexion, narrow-chested subjects. So this was all about tuberculosis. In the next lecture, we will be talking about cystic fibrosis. This session was powered by Digital Version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention it in the comment box. I will try to resolve it. Thank you very much.